Hi, welcome to our poster entitled Large-Scale Characterization of Gender Differences in Time to Diagnosis in Longitudinal Observational Health Data. This is work with my student and colleagues at Columbia University and Janssen. There is increasing evidence that there are longer time to diagnosis for women compared to men. But unfortunately, most of the evidence is published one disease at a time in one publication, in one population at a time. And so there is a gap here because it's difficult to replicate this finding across populations and across conditions. And so we aim in this poster to do exactly this. We take advantage of a large amount of data sets, a commercial claims data set, CCAE, Medicaid data set, Medicare, and the electronic health record at Columbia University Medical Center. And we look for cohorts of patients for 112 different conditions. We have been looking for conditions that are varied and span a large number of disease categories, such as metabolic or cancers. We look for, within these cohorts of patients who belong to a particular condition, we look backward from their time of diagnosis and identify what we call presenting symptoms, which are all the conditions that are common between men and women that are recorded in the patient's records. We have multiple ways of identifying these presenting symptom, one that is fully automated and one for gold standard purposes that is manually curated by clinical experts. We propose different ways of computing time to diagnosis, and I'll be referring to this, to one of them as diagnostic delay in my results. So the figures that I'm showing here is showing us the diagnostic delays in the large commercial claims data set. And, it's difficult to see, but the green dots represent the mean diagnostic delay for men, while the purple dot represents a mean diagnostic delay for women. And, I like this graphic because no matter what the disease here, there is often a delay or a long differences in terms of days between men in green and women in white. In fact, out of these 112 conditions in this large commercial data set, women experience a longer time to diagnosis than men for 108 of those conditions. Interestingly, the trend persists when we look at every database, and it persists as well. In fact, it shows even higher delays when we use the manually created presenting symptoms. And finally, the trend persists when we compute all these different metrics that we propose to quantify time to diagnosis. So it is striking to us that for most conditions, women experience a longer time between symptom onset and disease diagnosis than men. And I think it does a good job at highlighting systematic gender differences in these patterns of diagnosis. And there are many conclusions we can make out of this. And obviously, there are also some limitations to the type of data that we have. But I think the way we'd like to present our work is that it's a type of analysis that enables the generation of new hypotheses in a replicable way across multiple types of databases and population. I encourage you, if you're interested, in checking out our website, where there is all of our different results presented in interactive fashion. Thank you very much.